the Community Hour. This is Unity 101.
Welcome everybody to our show in the Community Hour. और उसी के साथ साथ आज हमारे साथ रहने वाले हैं जी हाँ, two special guests, and they are none other than Dr. Shiva Kumar, and she's the GP Southampton and diabetes clinical lead for Southampton and Southwest Hampshire CCG group. As well as the second guest with us would be Akif Farid Elahi, and he is the health educator for NHS Diabetes Prevention Programme. So a very warm welcome to both Dr. Shiva and Akib.
Thank you.
Thank you.
Okay, so it was very nice to have both of you in our show as well as in the Community Hour. Yes, as we were talking, so I'll directly go to you towards the question, Shiva. This question is for you. What is pre-diabetes actually?
Hi, I'm Dr. Shiva Kumar. I'm a GP in Southampton, as Shohini just said. So pre-diabetes is really your blood sugars that are higher than normal. So there are three ranges of blood sugars. One is your normal blood sugar when you have a blood test. Then you've got a mid-range, which is pre-diabetes, which means it's neither normal nor high enough to be diabetes. And then obviously you've got your bloods in the diabetes range. So it's that period where you are at risk of developing diabetes, but you haven't got diabetes yet. So that's basically what pre-diabetes means.
Okay, Shiva, my next question to you would be, who is, at what age group they are most likely to be at the risk of developing pre-diabetes and diabetes as well?
Yeah, so there are several risk factors that are involved. One of them is your gender. So if you're male as compared to a female, you have a slightly higher risk of having pre-diabetes or diabetes. If you're older, so usually we say above 40 years of age, but we are seeing it in younger patients as people are becoming more overweight, which is across the world actually. Being from a South Asian background, so people who come from countries like India, Afghanistan, Pakistan, Bangladesh, Nepal, Bhutan, Maldives, Sri Lanka, so those are the South Asian countries. So people who originate from those countries, blacks, Chinese, and people of mixed ethnicity. Also having a family history of diabetes in your parents or brothers or sisters puts you at a higher risk. Having a bigger waist size. So carrying more weight around the tummy area, being overweight, having hypertension. These are some of the risk factors that predisposes you to, being in the pre-diabetes or the diabetes range. But that doesn't mean that women aren't at risk, that people of white ethnicity aren't at risk. But like I mentioned earlier, the risk factors, which I've just mentioned, those people tend to be at a higher risk of developing diabetes. So mainly in the Asian and African ethnicities where we see more people developing it.
So a quick question, is there any particular age group they are more likely to get diabetes or pre-diabetes?
So, like I said, people probably over the age of 40, say after your 40th birthday, that's why the NHS health check is there. But we are seeing it in younger people, so people in their 30s and their 20s. In fact, we are also seeing it in children because a lot of it is to do with weight gain, and I think we're seeing it in younger and younger people. But as your age increases, the risk increases. So I would say people above the age of 40 are at a slightly higher risk as compared to people who are younger than 40. But having said that, there is no age now. We do see it in younger people as well.
Okay. So just a quick question to you, Shiva, one more. Should you think, or what do you think a family or one should do if they know, anything about pre-diabetes and diabetes, if that family or if that particular person already had diabetes?
Yeah. Yeah, so you cannot change some of the things. You can't change your gender, you can't become younger, you can't change your ethnicity, and you can't change your family history. But what you can do is you can maintain your weight, you can become physically more active, and you can therefore reduce your risk of developing diabetes going forward. It's not all doom and gloom. So, you know, we can be in control of our health, of our weight, of our physical activity. And also, if you have diabetes already, say somebody's already been diagnosed with, type 2 diabetes, they can still make a lot of changes to their diet, to their physical activity, and there are people who have reverted their diabetes back to normal blood sugar levels, so you can reverse it. You can reduce the number of tablets you're on. You can come off injections. So, there is a lot you can do. It doesn't mean that if you've already developed pre-diabetes or diabetes, that's it. That's the end. There's lots that you can do, and prevention is always better than cure. So it's probably, if you know that you have pre-diabetes or you're at risk of developing diabetes, it's better to make the changes at that time rather than trying to do it when you have developed diabetes, so you can prevent it. Because if you look at diabetes and the long-term complications, they're all quite serious. People with diabetes can develop blindness, they can develop heart attacks, heart failure, strokes, limb amputations, kidney failure, and we probably all know one or two people, who are quite close to us who probably have diabetes and have unfortunately had one of these complications. So. And treating diabetes itself, does involve, medications, tablets, injections, insulins, lots of appointments to see your healthcare professionals, and also affects mental health. So I think if we can prevent it from happening in the first place, that's probably a better thing to do. But if you've already got diabetes, you can still make a lot of changes and improve your outcomes. So that's the message I would like to give to your listeners, Shohini.
Okay, as Akib is also with us, and he is also the health educator for NHS Diabetes Prevention Programme. So next question to you, Akib, as Dr. Shiva is also telling, like, prevention is better than cure. So what is actually the Diabetes Prevention Programme? If you can just enlighten us on it.
Okay, so thank you, Sony, for your question. So essentially, the Diabetes Prevention Programme is a joint commitment from the NHS England, Public Health England, and Diabetes UK to help reduce levels of diabetes in England. So India's is one of the main providers that delivers the Healthy You Diabetes Prevention Programme in partnership with Leicester Diabetes Centre, who designed the curriculum. So basically now, because of COVID-19, we are transitioning our service to online. And it's a group program delivered online via Zoom platform, and all participants, all they need is basically an internet connection or a telephone. We can dial in. So basically, to give you a better context of the program, each group has a trained educator, and there are 13 sessions in total, and they take place every 3 weeks. And we try to keep it at the same day and the same time where possible, and it is 1 hour long. So there's a lot of support for patients to get set up with technology beforehand. And for some people, it might not be easy to set up with technology, so we've got that support in place. And we basically have a very friendly and welcoming group. So in a nutshell, the NHS Diabetes Prevention Programme is a behaviour change programme with use of empowerment strategies to help support participants to understand what exactly is pre-diabetes and what simple lifestyle changes they can make to reduce the risk of type 2 diabetes and its complications. So similar to what Dr. Shiva was mentioning earlier, and it's generally just to make control of their overall health and well-being. So it's about empowering people to take control of their health and well-being. And basically in the program, we cover topics from understanding pre-diabetes, similar to what Dr. Shiva talked about, where the blood sugar levels are basically higher than a normal range. We talk about the risk factors associated with pre-diabetes. We do talk about healthy eating, things like portion sizes, weight management, physical activity. Also mental health is very important. And also goal setting, and basically helping people to set themselves personalized goals where they can be realistic and achievable, and helps participants, take control of their health and well-being.
So a quick question to you, Akib. If somebody wants to join to this prevention programs of diabetes from NHS, so how can they join the program now?
Okay, so that's a very good question. Thank you. So basically, if you go to stopdiabetes.co.uk, because of COVID-19, you don't really need a blood test anymore. So if you go on www.stopdiabetes.co.uk, and there is a tool assessment score we have to fill in, and just ask simple questions about your age, your gender, height, weight, etc. And if it does come up as high risk, then you automatically can refer yourself to the NHS Diabetes Prevention Programme.
Okay. So is there is there any particular language the program goes on, or is there multiple languages the prevention program offered in the locality and even among the communities?
Yes, certainly. So basically, in Hampshire and Isle of Wight, the program is delivered by Injus, which is one of the providers for the NHS Diabetes Prevention Programme. And we do deliver sessions in English, Hindi and Urdu, and it's delivered by myself, and I'm honoured to become the BAME lead educator for the NHS Diabetes Prevention Programme. So delivering the sessions in diverse South Asian languages has helped us to tackle language barriers in the services, and also able to culturally tailor the lifestyle changes to the South Asian diet, people's beliefs and religion side of things. And on top of that, we have had a successful case study of a participant from a South Asian background who did attend all 13 sessions, and as a result, it did help reverse her pre-diabetes diagnosis, and found that speaking in Hindi did really help her to make those lifestyle changes. And the full case study, alongside other case studies, can be found at www.stopdiabetes.co.uk.
So it would be really helpful, as we came to know from you, the prevention programs are being run in different languages. So it would be really helpful to all of the communities as well as to our listeners too. There was a quick question, I just want to add it to you, Akib. Is there any particular diet a person should follow for pre-diabetes?
That's a very good question, Sony. So basically, the program is basically generally about a balanced diet and physical activity that's tailored to each individual. So it's not always about going to the gym to get active or following a low-carb diet, especially all diets are different. But in the program itself, we do just talk about healthy eating. So basically, it's about moderation. The message is about just cutting down on foods that are basically high in carbohydrates, on saturated fats and salt, for example. And it's about the moderation message about making realistic and sustainable changes, which is easy and realistic ways to build physical activity into people's lives. And obviously, we know everyone's different, so everyone's approach will be different. And helping people find what works well for them is very important for long-term success and, for consistency.
So, a question to you, Dr. Shiva. As Akib was telling, diet is also important for us to prevent from diabetes as well as pre-diabetes. So, a quick question, will one definitely get type 2 diabetes if one has a diagnosis of a pre-diabetes?
No, not really. So being at risk doesn't mean that you definitely will develop type 2 diabetes, but it probably is time to maybe make some healthy changes to your lifestyle and reduce that risk going forward. The studies show that 3 out of 5 people can prevent type 2 diabetes. So that's nearly 60% chance of preventing diabetes if you were to change your lifestyle. And like Akib said, we're not asking and we're not promoting, these fancy diets that you've got to stop eating everything and you've got to have, boiled vegetables. That's not what the program is about. It's about the food that you normally eat, day in and day out. what you're used to, what your palate is used to, what you generally eat. And it's just making just small changes, maybe to the portion, or maybe swapping things around a little bit, which I guess Akeeb could tell you a bit better. It's making those little changes in your daily life, which can go a long way in preventing developing diabetes, which obviously is the message. Try and prevent it rather than cure it.
So as Akeeb, Dr. Shiva was telling, it's better to try and prevent it, better to get it. As you were talking about the programs, like the prevention programs, so are the programs already pre-recorded, or you go and teach us the local community how to go ahead with that, how it works? I'd really love to know along with my listeners.
Okay, so thank you very much for that question. So all sessions are live. So participants in the group interact with each other, and they participate in discussions, ask questions, they share their thoughts, their progress, which can only be done live. And all participants are provided with a handbook before they join the program. So they can also refer in between the sessions, with the handbook. Also, if people do miss the program or the sessions, then we can contact them. So myself, educators, or the contact center are always there for people to rebook them into any live sessions missed. So in a nutshell, if people do miss any sessions, we can always get them rebooked in, and they can always continue that way.
Okay, that's really very, would love to know about that. And a quick questions, Dr. Shiva, to you. Does one need a blood test, even before the age of 40, if they think they are having certain symptoms of diabetes or pre-diabetes, something like that?
Yeah, okay. So pre-diabetes has no symptoms. If you've already noticed some symptoms and you're worried, then probably you should have a blood test, because what you want to make sure is this is not diabetes that you've already developed, because then going into this program, which Akeeb is mentioning, is not suitable. It's a prevention program, so it's for people who have pre-diabetes. Usually pre-diabetes has no symptoms. So I just want to make people understand that if you've got any symptoms, straight to your GP, tell them you're getting symptoms. They will do a blood test and rule out diabetes. Obviously, if you're in the pre-diabetes range, then you can refer yourself to this program. So blood test until COVID started was mandatory. That was the only way you could be referred onto the prevention program. Because of COVID and not many blood tests happening in primary care, what NHS England has now suggested is that people can go online, like Akeeb mentioned, the Stop Diabetes website. If you actually look at the website, the third option from left is join the program. Click on that. You should be able to do a risk score for yourself. You will need to know your waist measurement and your height and weight, but it's got a BMI, body mass index calculator on that screen. So and then it gives you a risk. So if you're at moderate or high risk, it gives you a score, and it tells you what your risk is of developing diabetes. There is then a little button which you can press, and you can self-refer using that form. So either a blood test that your GP has already done it can be used, or you can self-refer, like I've just mentioned, by going on the website for Stop Diabetes. Having said that, people who've had bloods in the past, say in the last 2 years, were told by their GP that they had pre-diabetes, but didn't at that time want to join the program, they can still do it. So the referrals are open until April next year for anybody who's had a blood test in the last 2 years who were in the pre-diabetes range. So, to the listeners, if you have been told by your GP that you had a mention of this prevention program, please go ahead and join it, because you can still do that even though your blood tests were done a couple of years ago. So you can either self-refer using the tool, the risk assessment tool, or a blood test. So either is okay at the moment.
Thank you, Shiva. Thank you, Shiva. That was quite informative, because that was I was supposed to ask you after that, what help and support one can get if those people were diagnosed with, or they came up with the blood results of having pre-diabetes or so. So a quick question to you, Akeeb, now. So what would be the waiting time time if one is referred by a GP or if a self-referral is made for the prevention program?
Okay, thank you, Soini. So currently, when patients are referred who want to join a remote service during COVID-19, the good news is there's no really waiting list. There's plenty of space, times during the day, evenings, and on Saturday weekends for participants to join as soon as they like. So because we're running a remote service, it's beneficial in terms of managing wait times. As India's the main provider of the NHS Diabetes Prevention Programme, can adapt easily to referrals coming in, and session spaces are really available anytime.
Okay, so Dr. Shiva, so how successful is this diabetes prevention program, as you are working directly with the patients, those who come up to you with certain symptoms and certain complaints even sometimes? So how successful is this diabetes prevention program, do you think?
Yeah, so this program, the NHS Diabetes Prevention Programme, started in sort of a few phases and started in 2016, the first phase, and now covers the whole of England. So it's running across not just Hampshire, but across the whole country. And the success is slightly different in different areas. But if you look at the overall figures, I couldn't tell you the figures in my own surgery, but 1 in 20 people who attend the program have either delayed or prevented type 2 diabetes completely. But I think it's not just the program, it's the changes that need to be made to your lifestyle. So the program can guide you, can motivate you, can tell you what to do and advise you and work with you, sort of personalized, advice. But in the end, I think it's the person. It's down to them to make those changes and sustain them long term, going forward. It's not just for the next 9 months or 12 months. It's for the rest of your life. You should be able to get, so that those 9 months that you get the advice, you should be able to make those changes going forward, where you're watching your portion size, you're eating healthy, you're physically active, and that's the whole purpose of the program, is to empower you, like Keith said, for the rest of your life, so that you prevent it and you don't then end up getting diabetes 5-6 years down the line. So it's to maintain that.
So Shiva, and welcome back to Shiva and Akib again after the advert break. So I would love direct questions to you, because this was a question from my listeners too for a couple of weeks, as we were asking our listeners, like, what could be, like, what would you love to ask our special guest regarding diabetes. So there was a question from one of our listeners, and it was quite concerning too. So they asked, what are the telltale signs, or basically if we ask, like, what are the symptoms of pre-diabetes and diabetes?
Yeah, so pre-diabetes, like I said earlier on, has no symptoms. So it's usually picked up on a routine blood test, or if you actually calculate your risk score by going on the website. And what I may do, Sohini, if it works for you, is give you the link, which if you don't mind putting it on your radio website, so people can just click on the link and calculate their score and see if they have if they are in the pre-diabetes range or at risk of developing diabetes. So that's possible. I can email it to you later. So if you've got symptoms, don't do that risk score. Speak to your GP. They may want to do a blood test and see whether you've already developed diabetes. So this program is not for people who probably have symptoms already. Some of the symptoms that we see with diabetes is feeling excessively thirsty. So you're drinking a lot more water as compared to before. You're passing a lot of urine. You're feeling extremely tired. I mean, we all get a little bit tired, but if your tiredness is more than usual, or your vision is affected. So I had a patient not so long ago who presented with blurred vision, and we checked her sugars, and she had diabetes. So if your vision is getting blurred, again, quite a sudden change in your vision, or if you're losing weight suddenly, unexpected weight loss, genital itching, or you're getting repeated episodes of thrush, or you've got wounds that don't heal. These are some of the symptoms, but unfortunately some people with type 2 diabetes may have no symptoms at all. So again, that is a bit of a worry. But if you have any symptoms, like I mentioned, don't do your risk score. Speak to your GP surgery. They will do a blood test, and they would want to make sure you haven't already developed diabetes. So obviously the treatment and the management is very different if you've already got diabetes.
So ma'am, there was another listener who would also love to ask from you and know from you, what is the basic difference? Because we normally don't know, like there are basically two different types of diabetes, that's type 1 and type 2. So what are the basic difference between type 1 and type 2 diabetes?
Yeah, so you're quite right. There are two main types of diabetes, type 1 and type 2. There are some other rarer forms as well, which I wouldn't want to cover because it'll just confuse your listeners. So type 1 basically is diabetes when your body suddenly stops making insulin. So there's absolutely zero production of insulin from in our body, so which naturally our body produces. We tend to see that in younger people, so in childhood, early teens, early 20s. It can occur at any age, but it's the younger population which can develop type 1 diabetes. It's quite sort of sudden onset. People become quite unwell with type 1 diabetes, so they'll present quite unwell a lot of times to general practice or even to the hospital, and they need very, very urgent attention. They need to start insulin pretty much straight away, and there's no other treatment. It is insulin only because their body is not producing any at all, and we definitely need insulin. Type 2 diabetes, whereas we see that in slightly older people, so people after their 40th birthday mainly, and that's why you have the NHS health check starting at 40. But we do see it in younger people. We are also seeing it in children now. And it is a bit different to type 1 diabetes in the sense that your body is still producing insulin. So insulin is something that our body naturally produces in response to food that we eat. So when we eat food, and it's not just sort of sugar that we add to our tea and coffee. So any food that we eat, like bread, pasta, chapatis, rice, fruits, they all contain sugar. Okay, so when we eat that, our blood sugar goes up, the insulin gets produced in our body, and that insulin then moves all that sugar in the blood into our cells. So that's how insulin works. When you have type 2 diabetes, either you're not producing enough, so it's not zero production, but it's either not enough, or what you're producing is just not working. So it's not a defective form of insulin. It's still the same form of insulin. It's still the same insulin, but it's not shifting that blood sugar from the blood into the cells, and that's why our blood sugars rise. And that's the basic difference between type 1 and type 2. Type 1, there's absolutely no insulin production. In type 2, it's either less or it's not effective. You've also got gestational diabetes. Some women go on to develop diabetes during pregnancy, and like you mentioned, there are some rarer forms. So people of South Asian descent, like I mentioned those few countries earlier on, they are at 6 times higher risk of developing type 2 diabetes. So the risk is much higher in South Asians. In people of African origin, the risk is about 4 times as compared to people from white ethnic backgrounds. So the risk is much higher in that population, and that's why they need to make sure that if they are at risk, they don't have diabetes still. There is this great prevention program that's available locally and now also in Hindi and Urdu, that they do avail of it and make those changes.
So that was really very much informative, and now I think at least my listeners, they can differentiate between the type 1 and type 2 diabetes. So I'd love to ask you, so which kind of a diabetes can one get if pre-diabetes is not being addressed at the right time, or if it's not being addressed properly?
Yeah, so if you've got pre-diabetes, like that you've had a blood test and that's in the pre-diabetes range, or if you've done your risk score and you are, moderate to high risk of developing diabetes, then it's the type 2 diabetes that you are probably going to develop later on, not type 1. Having said that, the risk basically that you calculate is your risk of developing type 2 diabetes. Like I said earlier on, anybody can develop type 1 diabetes, but your risk is mainly, with pre-diabetes, is mainly development of type 2 diabetes going forward. So that's the type of diabetes you could develop if you have pre-diabetes, type 2 diabetes.
Okay, so what could be what complications can occur with diabetes? Like as you mentioned earlier, like there could be certain complications if we are if we don't take right action at the right time. So what could be the complications for diabetes?
Yeah, so when we talk about diabetes, I think we only think of blood sugar and blood sugar being high, but people with diabetes must also, and their GPs and nurses probably, measure their blood pressure as well. They also check their blood cholesterol levels, and it's very important that all three, your blood sugar, your blood pressure and your cholesterol, is addressed, because all three of them together can increase your risk of complications, like I mentioned earlier. And I'll just repeat it just so that there's a better understanding. So blindness, if you go from top to bottom: blindness, stroke, heart attacks, heart failure, kidney failure, limb amputation. So lower limb amputation is what we're talking about. And those are all very, very serious complications, but they do occur, and people with diabetes are just at a higher risk of having all these complications. So when you go and have your annual review with your GP and you have these bloods and your blood pressure done, your GP or nurse would probably want to address all three. So they would want to, improve or, give you more medication for your, blood sugar. They may also ask you to take a blood pressure tablet and maybe take a tablet to lower your cholesterol. And what they're trying to do is not just address your blood sugar, but also your blood pressure and your cholesterol, to reduce that risk of complications, because the complications don't happen only because of your high blood sugar, but those complications, those very serious complications, happen also because you've got high blood pressure and cholesterol. So what you're trying to address is reduce all three to then improve your outcomes and reduce that risk of complications going forward. And also stopping smoking. So people with diabetes or even otherwise, if they're smoking, that increases their risk of heart attacks and other complications, and also amputations, and also people who drink alcohol above the recommended limit. So when you're making changes, I think stopping smoking, reducing your alcohol intake, all that helps in reducing your risks going forward.
So there was another listeners, and she forwarded questions towards you. So she asks, a number of her family members and friends have type 2 diabetes. So what can she do to prevent it? Or how likely she's going to get it, as a number of her family members have got that type 2 diabetes. So is she also likely to get that diabetes too?
So there is that risk. Obviously, having a family member, so immediate family member, your first degree relatives, which are your parents, your brothers or sisters, if they've got type 2 diabetes, you're obviously of South Asian or African descent, those are things that you can't change really. It's not in your control. You can't change your ethnicity, and you can't change your family history, and you can't change your age. But what you can do is you can change your lifestyle. That's what you can control. And you can change your weight, you can have a better weight management, you can improve your physical activity. So not asking you to run or join the gym, but just, improving that. And I guess Akeem could touch a little bit on that a bit later on. But so you can reduce your risk, or you can delay. So, less number of years somebody has diabetes, the lower the risk of complications, as I've just mentioned earlier, or actually completely prevent it as well. You will not get diabetes if you can maintain. So when your listeners if they can go on that platform, the Stop Diabetes one, and calculate that risk, it's got about, I think, 6 things that actually you've got to put in, and then calculate your risk. And if you play around a little bit, so say you have a higher BMI, but if you then see what your score is, and then say just to see what it would be if your body mass index was in the normal range, you just see that suddenly your risk decreases. Your score is much lower. So, those are the things you can control. So it doesn't mean that if you've got pre-diabetes or you've got a family member with type 2 diabetes that you will definitely get it. But you've got to make some changes.
Okay. So Akeem, so can you just let us know what programs or how how can the prevention program help us or help people so that they can prevent if some of their family members or number of their family members have type 2 diabetes?
Thank you, Sonia. That's a very good question. So touching back on what Dr. Shiva mentioned earlier, that we know pre-diabetes can be preventable. So in how it would support you, we will talk about what is pre-diabetes. So we explain to you, the bit of the physiology in simple terms so people understand why the blood sugar levels are higher than normal. And we also do give every participant a resource pack, and that will guide participants into the right direction on how, that will support them in the long term. And of course, you get a accredited LDC trained educator. So, you get all of the information from a educator as well. And also, we do touch on the risk factors, some what Dr. Shiva talked about earlier. So we do talk about the risk factors that you can change. For example, sedentary lifestyle, we can change, the weight around the middle, high blood pressure, high cholesterol. And we also do touch on the risk factors that you can't change, things like, age, ethnicity, family history, etc. So basically, the content of the program, it can be tailored to different cultures. And we can also, again, we touch on, we can speak in different languages, in Indian Urdu, and we can basically help people from different ethnic backgrounds to tailor what works for them.
So, Aqib, a question to you. If someone registered with this prevention program, so does they have to pay for it or it's free?
Okay, so the beauty of this program is a free NHS-funded national program. So it's free for everyone who does join.
Okay, so it's absolutely free for anybody, right?
Yeah, that's correct, yes.
And if, general question, if you can say it's from me, if somebody joins on that program, and will they have to go on a diet or they have to join a gym? Is it mandatory?
So that's a very good question. So saying what Dr. Shiva mentioned earlier, that we just talk about healthy eating. And also when it comes to physical activity, it doesn't always mean going to the gym. So people can, physical activity means just being active. So things like walking, cycling, things like gardening, doing housework. We just encourage people to do things they enjoy and just do as much as they can. So we know the recommendations are about 30 minutes a day, but we do understand that every individual is different. There could be some individuals who are less mobile than others. So it's about just encouraging people to do what they can do in their own ability. And again, we do talk about healthy eating. So we're not telling anyone to avoid anything. So for example, let's talk about the South Asian diet. We know there's a lot of chapati involved, a lot of rice, different oils, etc. So what we do kind of say is about just cutting down on things like saturated fats, on sugar, on salt. And for example, going from white chapati to wholemeal chapati, cutting down on ghee in cooking, etc., etc. So it's just about helping people with the ingredients they put in their food, about the portion sizes and the quantity of food. So for example, coming back to the case study of a South Asian participant who completed all 13 sessions of the NHS Diabetes Prevention Programme, she did simple lifestyle changes with her activity. It's about just changing the ingredients to her food. And that's all helped with the weight management side of things. It helped her with being more energetic. And it also helped her husband with what worked for her. And as a result, her blood test did come back to a normal range. So in a nutshell, it does, this NHS Diabetes Prevention Programme does really help people take control of their own lives and make simple lifestyle changes that could help them in the long term, and as the end result to reduce the risk of type 2 diabetes and its related complications.
Okay, and thank you, Aqib, for letting us know about that. As well as, look, nowadays, everybody is so much busy and they are busy with their work, some are busy with their children. So how much commitment is required for somebody if they join that program? Because we also need some time, right?
That's correct. So thank you, Sonia. That's a very, very good question. So when it comes to the commitment of the program, we're very flexible. So generally speaking, every session is 1 hour long and it takes place every 3 weeks. And in between those 3 weeks, we do, encourage participants to set themselves goals in between. And, we do give opportunity to everyone to get back together and share, what is working well for them and also challenges where everyone gets together and support each other, to overcome any challenges. And it's about encouraging others and giving each other more ideas to what they've been doing since the last few weeks, etc. And we're very flexible on the days, the times, and we also do Saturday and evening sessions as well. So very flexible for people who are busy working or have a busy schedule as well.
Okay, so yes, we'll be right back to you with Shiva and Akib. And welcome back again once after this advert break. And once again, welcome back Shiva and Akib, and thank you for being with us for this community hour. So my direct question would be to you, Shiva, because it was being asked by one of my listeners. What can be done? Because she was quite curious about, because often it happens people do get diabetes during pregnancy. So what can we do to avoid diabetes related to pregnancy?
Yeah, so like with pre-diabetes, I think maintaining a good pre-pregnancy weight, so before you even get pregnant, is quite important. So if you have, if you're carrying less weight, your risk of developing gestational diabetes is lowered. Doesn't always go away, but does become less. So having a good, well-maintained weight pre-pregnancy, and also making sure that you don't put on too much weight during pregnancy, because that's quite common. That's quite easily done. So making sure you're eating healthy, remaining physically active, maintaining a good weight throughout pregnancy can reduce your risk of developing pregnancy-related diabetes. But having said that, some women still develop it, and it's unfortunately one of those things that are related to pregnancy. But you can reduce your risk. Like I said, maintain a good weight before you get pregnant and throughout pregnancy. Try and not gain a lot of weight, so still control your portion size. Make sure you're eating healthily and you're physically active during pregnancy as well.
Okay, so Akib, I'd love to ask you, is there any particular prevention program specifically for the female groups?
So thank you for that question. So at the moment, we are looking into how we can take, things forward from what we're doing right now. So, a couple of months ago, we have trialed the sessions in Hindi and Urdu, and that's going really well. And we're always looking for ways to how we can, add in new things on the way. So we are definitely looking into it and see what we can do about that.
Okay, and there was a question to Dr. Kumar for you. One of our listeners, she asked, often, what happens, often we have tingling and numbness or pain in our feet in general. We do, we take just a paracetamol, but is this a concerning sign or a symptom for pre-diabetes? Or what should we do in such a scenario?
Sure. Okay. So, like I said earlier on, pre-diabetes has no symptoms. Tingling and numbness may or may not be diabetes related. There are sometimes no reasons, and sometimes you could have sort of other reasons for tingling and numbness in your feet. Could be B12 deficiency. Could be a lot of reasons. I think not knowing the entire history behind the symptoms can be quite tricky to just give advice. But what I would suggest is, if your listeners are in that risk group, they're concerned that they could have diabetes, I would suggest they speak to their GP and get some bloods done in the first instance. And if diabetes is then ruled out, then that is great. But their GP may want to do some other bloods, maybe examine them, and take a bit more history and get down to the bottom of what their symptoms are. But having said, I would just repeat, pre-diabetes usually has no symptoms, and this is not a specific symptom of diabetes, but I think if they're concerned, your listeners, it's worth having a chat with their GP so that the GP can get a bit more information about this particular symptom that they're having, and then explore and maybe do bloods accordingly, because you may not just need diabetes bloods, you may need some other blood tests as well.
Yeah, surely. I think after getting an answer from you, who is obviously the lead in this area, as well as they will surely contact their GP and they will be discussing the matters further on. And as like once when we open up a social site, we can get so many information. So is there any particular site where we can get more information on pre-diabetes from NHS?
Yeah, so the Stop Diabetes UK website, which Akib mentioned and I mentioned, that's a really good website, and it's pretty much just for pre-diabetes, and it's got loads of resources, lots of patient stories, but also the risk assessment tool. It's the third one from the left. Join the program links. If you click on that, you should be able to, assess your score. It's also, you can do your score in lots of different languages. So say you can't read English, it's there in Hindi, it's in Urdu, it's in lots of different languages. I think when I had a look at it recently, it was in over 10 languages, I think. So, for your listeners, if it doesn't have to be in English, they can use other languages to assess their score. So that's one website, Stop Diabetes UK. So if they just Google Stop Diabetes UK, don't have to remember the whole website name, they should be able to get to that website. And the other one is Diabetes UK. So Diabetes UK has got one section on pre-diabetes, but also loads and loads of information on diabetes itself, type 1 and type 2. So again, for your listeners who are listening today who've already got diabetes, that's again a very, very good website, Diabetes UK. They've got lots of sick day rules, they've got diet, recipes, lots and lots of information about looking after your feet, retinal screening, which is eye screening. So lots of information there on Diabetes UK. But for pre-diabetes, I would suggest looking at Stop Diabetes UK website because it's got a lot more information on it.
Okay, to all my listeners, so just if you are concerned about anything regarding diabetes or pre-diabetes, for pre-diabetes you can look at it at Stop Diabetes UK, and for diabetes you can look at Diabetes UK's page. And to Akib, normally if someone listens about your prevention program, the first question comes to their mind is how this program is going to help them and how they are going to be supported. So if you can say a little bit about it, because it's a normal thing a normal human being will think about. Okay, so this program is going on, so how it's going to support me?
Okay, that's a very good question. Thank you, Soini. So, though, as Dr. Shiva said, pre-diabetes can be preventable, and, you always have a trained educator who's always here to support you with personalized everything that will work for you. And, why should you join now? Not only is it a free NHS service, as we've seen people, who've been hospitalized with COVID-19 had diabetes. And, the beauty of now is that anyone can check their risk and no blood test needed. So as Dr. Shiva said earlier, go to stopdiabetes.co.uk and complete a Know Your Risk form. And you can join because it takes simple lifestyle changes to reduce your risk of developing the onset of type 2 diabetes. And coming back to what Dr. Shiva said earlier again, is that prevention is better than cure. So the better we prevent it, it can stop from other complications in the future.
Okay, so as the clock is also ticking and we also need to end our show too, but before ending, I'd love to ask Dr. Shiva, would you love telling something in Hindi or Urdu to all of our listeners?
Yes, of course. मैं हमारे लिसनर्स से यही कहना चाहूँगी, यही मैसेज आपको देना चाहूँगी कि डायबिटीज प्रिवेंटेबल है. ज़रूरी नहीं है कि आपकी फैमिली में अगर बहुत सारे लोगों को डायबिटीज हुई है तो आपको भी होनी चाहिए या होगी, लेकिन इसके लिए आपको थोड़ी सी मेहनत करनी पड़ेगी, थोड़ा सा अपने लाइफस्टाइल को चेंज करना पड़ेगा, अपनी डाइट को थोड़ा सा चेंज करना पड़ेगा और थोड़ा सा फिजिकली एक्टिव होना पड़ेगा. एंड ये छोटी छोटी जो चेंजेस आप कर सकते हैं अपने लाइफस्टाइल में, ये इन द लॉन्ग रन, मतलब आगे जाके फ्यूचर में आपकी डायबिटीज के रिस्क को काफी कम कर सकते हैं. एंड आई थिंक डायबिटीज से शुगर, आपकी ब्लड शुगर बढ़ी हुई नहीं होती. इसके जो कॉम्प्लिकेशंस होते हैं डायबिटीज से, जो और प्रॉब्लम्स हो सकती हैं जो मैंने पहले मेंशन करी हैं, आई थिंक वो बहुत इम्पोर्टेंट है उसको समझना कि वो risks आप कैसे reduce करें. And I think the best thing is कि अगर आप in the first place diabetes ना ही हो आपको, वो बेस्ट है एज कम्पेयर टू डायबिटीज हो. पर अगर आपको हो गई है डायबिटीज, तब भी आप बहुत कुछ कर सकते हैं अपने कॉम्प्लिकेशंस को रिड्यूस और प्रिवेंट करने के लिए. तो मेरा मैसेज यही है कि यही वक्त है अपना डायबिटीज, अपनी हेल्थ को आप थोड़ा सा गौर करें उसकी तरफ. और हमारा जो प्रिवेंशन प्रोग्राम है जो लोकली रन करता है, जिसको हम हिंदी और उर्दू में भी करते हैं, बिकॉज हमने ये समझा कि इसकी इम्पोर्टेंस है और इसकी जरूरत है साउथहैम्पटन में और वेस्ट हैम्पशायर और जो बाकी हैम्पशायर में जो लोकेलिटीज हैं जहां BME पॉपुलेशन है. तो आप इस प्रोग्राम को ज्वाइन करें अगर आपको लगता है कि ये आपको बेनिफिट करेगा.
Okay. So another question came in from one of our listeners now. She was asking, like, how can one stay safe during this pandemic?
Yeah, so like Akeeb was saying, we've got now a lot of data, from COVID, and we've seen that people with diabetes, people who were overweight, who were older, men, people of Black and Asian ethnic minority, have been hospitalized with complications, and unfortunately there's a high risk of dying from COVID-related complications. So obviously, the government guidance at the moment is wear your masks, wash your hands, and keep social distance. We must adhere to all this, even if we think that we are low risk, because we may be low risk, but we could pass it on. And there are a lot of people who, could be asymptomatic, who may not have symptoms, but may be carrying the virus. So make sure we're all, following all the government guidance. The other thing is to make sure you're taking your tablets. If you've already got diabetes, you're taking your tablets, you're making sure that you're looking after your diabetes, you're maintaining a good weight, and you're physically active. There's nothing that should stop you from being physically active, even in the pandemic, because the government allows you to go out and, at least go for a walk. The other thing is to make sure if you're eligible for a flu jab, by your GP surgery, that you have your flu jab, not just this winter, but every winter, because it does reduce your risk, especially if you've got type 2 diabetes, the risk of getting admitted with complications, either with flu or with COVID. You could reduce that risk. We don't have the COVID vaccine yet, but we've got a flu vaccine, and people must, if they can, and have their flu jab this year. There's also, just quickly want to mention, Trend UK Diabetes has got really good patient leaflets on sick day rules. So when people with diabetes become sick or they catch an infection, their risk of complications can go up. So certain medications have to be stopped and then restarted when you're feeling better. But there's a lot of advice on Trend UK website for type 1 and type 2 diabetes. They're patient leaflets. They're very colorful, very, very simple to follow, and little things that you can do to prevent hospitalization if you become unwell, with underlying diabetes. So do have a look at it. It's called Trend UK, TREND, D for Delta, UK type 1 and type 2 diabetes sick day rules. Again, Shahini, if it helps, I can send you the link for it, which you could post on your website if possible.
Okay, thank you once again. And Akeeb, to you too. If before ending, if you would love to say something in our communal language, or mostly to our listeners, so if we can go ahead, something in Urdu or Hindi, if you can go forward for it.
Yeah, absolutely. So जो प्री डायबिटीज है ये प्रिवेंट हो सकती है, और जो हमारा जो NHS Diabetes Prevention Programme है ये आपके लिए फ्री है. और जो आप घर में, जो आपके पास इंटरनेट कनेक्शन होगा या आपके पास फोन है, आप ज्वाइन कर सकते हैं हमको, और हम आपको हिंदी, उर्दू और पंजाबी में भी सिखा सकते हैं. आपको ये सिंपल चीजें अपनी लाइफस्टाइल में आप क्या कर सकते हैं जो आपकी चांसेस रिड्यूस कर सकते हैं डायबिटीज फ्यूचर में. और हम आपको नहीं कहेंगे ये नहीं खाना, वो नहीं खाना. हम ये कहेंगे जस्ट मॉडरेशन में खाना, और सिंपल चीजें जो आप स्विच कर सकते हैं अपने इंग्रेडिएंट्स को, ये चीज हमको सिखाएंगे. और मैं लुक फॉरवर्ड करूंगा आप सबको देखने के लिए प्रोग्राम में. Thank you very much.
Okay, so thank you to be with us, Dr. Shiva and Akeeb, and thank you for informing a lot more regarding pre-diabetes, regarding the diabetes, as well as the prevention program that's being run by the NHS. And thank you for enlightening us like how we can go forward, as well as how can we join the prevention program, like what to do and what not to do. And the listeners to you. So you are listening to me, Shohini, along with you were also listening to our special guest, Dr. Shiba Kumar, who is the GP Southampton and Diabetes Clinical Lead for Southampton and Southwest Hampshire CCG, as well as Akib Farid Alahi. He is the health educator for NHS Diabetes and Prevention Program. And thank you once again for being with us and giving so much valuable information regarding pre-diabetes, diabetes, as well as the prevention program.
Thank you very much for having us.